Hi, and welcome to another episode of Arizona Center for Cancer Care's Cancer Now What vodcast. I'm very excited to be joined in studio today in honor of Breast Cancer Awareness Month by three professional women in the field of breast oncology. Mona Harnack with the Virginia G. Piper Cancer Care Network's Comprehensive Breast Clinic. Dr. Anushka Patel, radiation oncologist with Arizona Center for Cancer Care. Dr. Brenda Moorthy, breast surgeon with Virginia G. Piper Cancer Care Network, Comprehensive Breast Center of Arizona. Hello, ladies. Welcome to the studio. We're so glad to have you here today in honor of Breast Cancer Awareness. I will quickly introduce you each one at a time, if that's okay. Dr. Brenda Moorthy, who is a breast surgeon with Virginia G. Piper Cancer Care Network, Comprehensive Breast Center of Arizona.
Glad to be here.
Thank you for being here. We have Dr. Anushka Patel, who is a radiation oncologist with Arizona Center for Cancer Care. Thank you so much for being here.
Thank you.
We have Mona Harnack, who is a patient navigator with Virginia G. Piper Cancer Care Network's Comprehensive Breast Clinic.
Thank you for having me.
Yeah, ladies, thank you so much for being here. This is such an important time of the year for breast cancer, right? It's October. Everybody knows it's breast cancer awareness. And the three of you work closely together, but not all for the same groups, right? You are three community practitioners that come together for breast cancer patients so that you can deliver the highest possible level of care for people who are going through a breast cancer journey. Is that correct? Did I get that right?
That's correct.
Okay, great. So I want to understand how this happens, right? Why does this happen? How do you get three people with different backgrounds, different specialties, all passionate about breast cancer to work together in this way? I know that you all work as part of the Comprehensive Breast Clinic. Dr. Moorthy, can you tell me a little bit behind the premise behind the Multidisciplinary Breast Clinic and what exactly it entails and what that means? Because you're the breast surgeon of the group, right?
Correct.
Okay, so
correct.
what does that mean? What is
Correct.
a multidisciplinary clinic?
Good question. So typically when a woman is diagnosed with breast cancer, she's in general given those results by either the radiology facility or more typically by her primary care physician. And so then the next part is kind of like this big hole, right? There's a lot of questions that ensue. There are, appointments that have to be made. And a lot of times the primary care physician will then transition off to referring the patients typically to a breast surgeon. But it's not only, breast cancer is definitely a team approach to the disease. And so there are many specialties that are involved, including medical oncology, people who give medications to treat breast cancer. There's a radiation oncologist who gives radiation. And many times there are additional tests that need to be ordered in order to sort of complete the workup and really come up with what a treatment plan can look like. And if you think of just all of the pieces that I mentioned, that's a lot for somebody to have to sort of navigate through. So what we decided to do was to start off with once the diagnosis is made, and the patients are generally hooked up with a navigator like Mona. And I think just from that piece, it brings a lot of, I would say, assurance and peace of mind to the patients because now they have a point of contact. And that point of contact can then serve to make appointments with the breast surgeon, the medical oncologist, the radiation oncologist. So what we try to do is to not only help those patients make those appointments, but then we are all in essence working together to coordinate that patient's care.
Okay. And does that care then typically take place at the same location?
So there's different modalities of how it's done. So typically once the breast surgeon sees the patient, And that breast surgeon can be in a different location is where our multidisciplinary conference takes place, which is at our Deer Valley campus at the HonorHealth hospital. And so usually I will, as a breast surgeon, I will see the patient and evaluate them and order some additional testing. And that tends to, I think, work really well because it's sort of the first introduction to a lot of information that the patient gets. So once I have seen the patient and ordered a lot of the tests that I think are needed in order to sort of get the most information we can get, then Mona, if she's not already involved, will then get involved and touch base with the patient, and we schedule them for our multidisciplinary clinic.
Okay.
And so our multidisciplinary clinic is one day where the patients come in and they will see the medical oncologist, radiation oncologist, geneticist, social worker, nutritionist, all on one day. But the most important part of, or I would say an additional advantage is then we all, convene and do a little conference about the patient. And then I wrap it up with the patient using either a telehealth appointment. So
very cool. Very cool. So the patient gets seen by everybody they need to on that one visit, that one day.
Yeah, it can be over 1 or 2 days, but typically I think what's really helpful is it's one location. Mm-hmm. So if you're like me and you can't find your way to a different building, at least you know where you're going.
Yes, for sure. And I think too, there's something to be said about that because it's not that you have to go find one of your colleagues somewhere else, wherever they may be. You're all right there having the conversation together.
Yes.
And as a team, you can figure out the best course of action or treatment plan for the patient.
Absolutely.
So I love that. That's really important. And, patients then don't have to wait and for, days and days and days to figure out what everybody is thinking. They have cancer, they're scared, and they get the information back quickly. So that's awesome. Yeah. So, all right. So we've been diagnosed with breast cancer. We've got the diagnosis. We've seen Dr. Moorthy. Next up is Mona, from what Dr. Moorthy said. So what, as a patient navigator, right? Like in my mind, I'm automatically thinking, oh my gosh, what a relief that would be to have somebody kind of hold my hand through the whole journey. Because there's always things that people forget when they're, in front of the doctor, right? And someone else to be there to help them through that. What services really are included with what you're doing, and how is that stuff coordinated?
Well, once Dr. Moorthy meets with the patient, she sends me the message or that she would like to add this patient to our comprehensive breast clinic. I then reach out to the patients. Some of these patients I've known from the breast center and have sent to her already, so we've already established that relationship. But then I reach out, introduce myself, talk to them more about the clinic, help them with getting scheduled to the team of physicians, help them schedule any appointments to social worker, genetics, nutrition if needed. Discuss if there's any barriers that might play a part in treating with this patient, travel, things like that. That way get a social worker involved as well.
So you're kind of like quarterbacking for the patient at that point.
So when I get them scheduled, I also call them back. Once they're all scheduled, I call them back, go over the date, time, location, confirm everything with the patient. Also put together an itinerary, a hard copy, send it by email. That way they also have a hard copy. Follow up to make sure that they have all the additional testing that Dr. Moorthy has wanted, ask them to get done. So I follow up, make sure that's done, because that's important information that we're going to need at the day that we have the clinic in providing a more comprehensive treatment plan.
For sure. So if they go through this whole thing and they come in and they go through a day or 2 days or whatever it may be, and they get home and they're thinking, what just happened, right? And they don't remember something. Can they call you?
Oh, they always do, yes.
Is that
they
okay?
Call me. I encourage them to call me if you have a question. I'm the go-to person between the
patient,
the surgeons,
and
the doctors, and the patients.
Right.
They're like, I don't, I forgot what they had asked me to do. So I'll get the answer and I'll call them back. And they
Amazing.
have my number. They are always able to reach out to me.
Your phone must ring all day and all night long.
But it's very valid questions. I've been a navigator for quite a few years, been in the breast world for 23.
Wow.
And found that that was a very important need for patients from imaging aspect, and then after imaging and getting the biopsy, and then they don't know what to do. So it was very important to make sure that they know that they have a person to help them through this journey. And
It's huge.
where I
Huge.
fit
Thank
in.
you so much for doing that.
Oh, you're
It's
welcome.
amazing.
You're welcome.
And so
Her nickname is
Yeah.
the Angel.
the angel, that feels right.
Yeah.
That feels right. And your whole personality is just so calming. And I mean, I pray that I never have to go through a journey like this, but I
take care of
definitely
you,
know
though.
who I'm calling. if I probably call you before I call my other friends at the table.
Well, we do get patients that come from outside the facility and say, my friend saw this, will you be my navigator too?
That's amazing.
So, yeah,
I love
yeah,
that. That's
yeah.
huge. What a testament to you. That's really a
Thank you.
big deal.
Thank you.
So Dr. Patel, Mona has now talked to the patient. Dr. Moorthy has talked to the patient. Mona reaches out to you and even a medical oncologist if necessary, if the patient needs chemotherapy. And you say, okay, I'm coming over.
Yeah.
Okay, how does that work?
Well, typically Mona will do a good job coordinating our appointments. So typically we try to get medical oncology and radiation oncology to see the patient on the same day, especially if they're coming from far away. That way, just back-to-back appointments, and it gives a chance for the patient to see both of us at the same time and get an overview of their overall treatment prognosis and plan. Because Dr. Moorthy has done the introduction, and then we get to fill in a little bit of the details.
Okay, that makes sense. So from a radiation oncology standpoint, right? I mean, patients don't always need chemo, right? They might not always need surgery. They
Yeah.
might not even need radiation. They might need surgery and not, how do
exactly.
you know when it's the right way to go?
So that is the purpose of this clinic, is that we get to, with breast cancer, there's a lot of options. We can consider mastectomy versus lumpectomy and radiation. So we get to introduce all of those options to the patients, and then they get to sort of get the overview. And then the final, after we all meet and discuss the case, then Dr. Moorthy will go over the final plan with the patient. But even if chemotherapy is not needed, typically they may need an estrogen blocker or other forms of treatment through the medical oncologist. So really, I find it beneficial for the patient to be able to meet all of us up front. And in the end, if they don't need the radiation oncologist, at least they made an informed decision.
That's
about their
amazing.
care.
I love that. Even if they don't become your patient, they still got an opportunity to talk
Yeah,
to you and
that's,
understand why they may or may not need radiation.
Exactly.
That's a big deal.
And having that up front, I think, is extremely beneficial. Because
Absolutely.
oftentimes if we see them on the back end, it's a little bit of a whirlwind for them. While here, they get to meet all of us up front and understand everything. So it's really, I
love
really
it.
enjoy it.
That's great. So, I am in the healthcare world and I have been for quite some time. And this is not the way it typically goes, right? Patients start with their primary care doctor, then they get sent to somebody, and then they get sent to somebody else. And, then they get sent back to the other person and hope the doctors talked. And so what made you really decide that this was necessary? Like, what prompted you to say, hey, we can do better than this?
I think that when you're talking to a patient and you realize, how upside down their world has just been turned, and and I think just something that may seem routine to us is definitely not, routine to our patients. And I think we have such an incredible team with, the expertise and the amount of resources that we have through HonorHealth has just, but patients don't know all the resources we have. So it has, been something that I think all of us think about, and we think it's the perfect, sort of scenario where patients can come in, see all the specialists that they need to see in one place, and have all of their care coordinated. I think that's how, I would want to be treated. And so I I think it's just sort of a natural progression of, how to improve the quality of delivery.
Wonderful. And I'm
Yeah.
sure you're getting a lot of positive feedback from patients.
We really do. I think the first, so at some institutions when you go, you may see everybody all at the first visit. I have found that just tends to be so overwhelming for the person because they have very little, I think, data or information points about how is this going to affect them? What are all the details of their disease? So even when I'm finished with their, discussion, I always tell them, now that I've, created this 1,000-piece puzzle for you and all the pieces are all over the room, now what we are going to do is you're going to have time to digest this information. And then when you go to our multidisciplinary clinic, that's the time where you're going to kind of glue all these pieces together.
Oh, okay. That makes sense.
And it really does help them. So, we welcome family members to come when they come to the multidisciplinary clinic. And I have, so many times patients will understandably leave not knowing exactly how they want to proceed surgically. And so this allows them to get all the information from all the different team members so that they can sort of process it. And I'd say 85% of the time when they're finished with the clinic, they know exactly how they want to proceed. They are very comfortable because they feel like they've been supported through the whole process. They feel that sort of everything has come together. They're empowered by the information to kind of proceed with those decisions. So, and they are very, I would say, satisfied with the communication that we all have between us. So it's been very rewarding, I think, for all of us as providers, but I think we've done this since 2019, and I think we've had, at least I don't even know how many patients have gone through our clinic, but everyone has, unequivocally expressed how thankful they are that this exists.
That's wonderful. What a great thing to bring to the community. So how does someone, and I'll direct this question to Mona, how does someone become a patient in this awesome multidisciplinary clinic, right? Like doesn't everybody just go where their doctor tells them? Like people need to know that they have options and choices when they get a breast cancer diagnosis. How do they get to this place?
Well, there's several different pathways that they can take. They do listen to their primary care physician, so there's a lot of the primary care physicians that are within the HonorHealth network that all they have to do is go to the portal, place a referral to the comprehensive breast clinic. That comes to my queue. I will call the patient, discuss with them a little bit more about the clinic, and the first visit is going to be with Dr. Moorthy, and then at that point she will get them scheduled to the clinic after some more of the testing is done. Another pathway would be to patients start Googling. They go to our website, the Virginia G. Piper Cancer Care Network. They type in cancer clinic. It's out there. They'll see a phone number. There's also a place where they can just put their name, phone number, email. That goes to another queue that I check every day. Do the same thing as if it was a phone call. Sometimes if they do call, they get sent to our Hope line and through the HonorHealth, and they go ahead and register the patient, send it to my queue, and then I call the patients. There's a couple other pathways. Some of the outside facilities do send directly to Dr. Moorthy. She will then talk more about the clinic, and then they get sent that way. I follow cancer patients from the Breast Health and Research Center, which is located in our second floor of our building, which is our imaging center. All the cancer patients I follow, talk to them about the clinic. We also keep the primary care physician involved, let them know that we have a clinic, and if they're interested, I'm certainly able to help make those appointments and move the patient forward in their journey.
That's great. So it sounds like even if your doctor doesn't necessarily say, this clinic is where you should go, you can Google, breast cancer care in Arizona, and you'll see it come up.
Yeah, I've had patients that have been referred to another physician, and they've wanted a second opinion, and we do see new breast cancer patients for second opinions as well. And they've enjoyed it. We've had those patients come in, and they've just been overwhelmed that we were there to help them through it, other than doing, because otherwise they'd be doing it on their own.
Yeah, and I think that's a really good point, Mona, because I think we hear a lot that people don't necessarily know that they have to be their own advocate, right? And they have to get online, and they have to look for second opinions, and they have to, this is their life. You don't have to just take the word of one person. You can hear it from multiple sources. So I think that that's really great that people are actually taking responsibility for their own cancer journey, and seeing what the options are, right? I think that's important.
And it empowers them to make the decisions as well. I mean, we can give them all the information that we have and help them be empowered to make those decisions, and ultimately their decision which clinic they would like to be. But
that's amazing.
They chose us.
They usually choose you. Got it. Okay, got it. So, Dr. Patel, can you tell us, it sounds like you guys have an amazing program. And I mean, obviously, I don't think that our audience is going to have trouble understanding where to go. So what I do want to understand a little bit and talk through with you is the different types of breast cancer, because there's so many things you hear about breast cancer, right? Who's got the BRCA gene, and who's got this, and what are the risk factors, and how you treat it. And can you help the audience understand the differences in the breast cancer diagnosis?
Yeah, so a lot has changed. We used to solely rely on the pathological diagnosis. Most types of breast cancer originate from the duct of the breast. There is another type called lobular breast cancer. But most importantly is once they get the biopsy, we look at certain receptors like the estrogen, progesterone, and the HER2 receptor. There are 3 receptors we specifically look at, and that drives the treatment plan significantly, as well as the prognosis, and it tells us about the biology of the tumor. So once we get that biopsy, we're getting a lot of information up front, and that is at the time that they come see us in the clinic, and we're able to, again, put all the pieces of the puzzle together for the patient.
Okay. And then how does staging play a role in all of this?
Yeah, staging is really important, and it has changed over the years. We have a clinical and a prognostic stage that includes the ER, PR, and HER2. So that is extremely important for the patient to understand. And by introducing those other receptors in there, you can see that you can have a bigger tumor that's ER, PR positive and HER2 negative, and the stage can be lower. So the staging is important. It does help us when we ultimately decide what we're going to do with the patient, especially if we're going to consider chemo first or surgery first.
And how well do you think that patients in your environment really can understand that, right? Can really get a hold of that, get their head around the staging and the different, ways of treating.
Yeah, I think that's the important part with the physicians. We're all passionate about explaining everything in detail and educating the patient. I think having the patient, I think knowledge is power. So when the patient truly understands their diagnosis, and I just feel like it relieves the anxiety of the unknown. So just by going through the clinic, we go through all these specifics, and we dedicate time. Like a morning each week is dedicated to this, so we can spend time with the patient and go through these specific details.
Once a week you're doing it. That's amazing.
Yeah, I love it.
Well, and I love that you all are very smart and empathetic. You can tell that, it's not just the clinical expertise that you're bringing to the table, but it's also that other part, the bedside manner, the caring about your patients. And I think that, having gone through a cancer journey in my own family, that is something that makes all the difference in the outcome. So I love that about all of you. So speaking of long-term goals for patients, talk to me a little bit about survivorship, right? So let's say that someone goes through their journey, and people always think that when you're finished with your treatment, you're done with cancer forever and your life goes back to normal. But that is just not the case, right? So what does this clinic do in terms of survivorship. And I don't know if that's something that you want to answer, Dr. Moorthy, or is that more something that Mona handles? I'll let either of you decide how you want to handle that one.
Go ahead.
Okay. So you're absolutely right. There's going to be a group of patients who, have gone through their treatment and, there is a transition to kind of integrating back into normal life. And so what, as surgeons and radiation and medical oncologists, we do see those patients over the next 5 years. And we are in the process of building a very robust survivorship program right now because we recognize that there are certain needs that, we could do better with.
For sure. Well, that's great. And I guess that's really from somebody who invests their life in these patients as a career, right? That's the goal, is to figure out what's missing and to fill in those gaps. So that's really cool. Very cool.
Yeah.
So I have one question that's kind of in my mind right now, and I'll ask this one of you, Dr. Patel. So I've heard several times HonorHealth is involved in this. I know your Arizona Center for Cancer Care, which is not part of HonorHealth, but the breast surgeons are Comprehensive Breast Center of Arizona, but there's some HonorHealth in there. Can you help me understand how this all works together, how you're all coming from these different entities and supporting each other and how that works?
Yeah, so we all, we're sort of under the umbrella of Arizona Center for Cancer Care, and we're affiliated, at least our group's affiliated with HonorHealth. Certain of our members are actually under HonorHealth, we've all worked together for many years. These collaborations have been built up over many years of being able to work together. Now it's all coming pieced together. And then we are all now in the same building, which is actually really nice. So medical oncology, radiation oncology, and then the breast surgeons will be at the Deer Valley location. And that was sort of the premise behind the idea of creating this clinic, that everything's in one building, and Mona's also there as well.
So it sounds like by bringing in a hospital system, it allows you to have the resources that you need, like the services Mona can provide, that pretty much are more challenging when you're in a private practice. Is that the way that works?
Yeah, nutrition and social work, the genetics, piece of it. That's all being provided by the hospital. We've had that service for a long time. I mean, I used to send, but now it's all under one roof, which is really nice.
That's great. So it sounds like not just the physicians and the support staff, but even the hospital systems recognize the importance of this collaboration because that's what is going to allow us to do the best job in our community of delivering strong care. So that's good. I'm glad.
Absolutely.
Thank you for clarifying that because I see a lot of logos and a lot of things happening on the screens behind me, and so that makes sense. I appreciate that. And I love that you can all come together and work as a team despite the different brands and different names and different, it's all about the patient. So that's good. So I always ask all of the guests on this show because I think it's really important for the audience to understand why you all decided to do what you do. So Dr. Moorthy, I'll start with you, if you don't mind.
I don't mind.
She's like, Jenny, you're going off script. So I will ask you, what made you decide to focus specifically on breast cancer? Why was that something why not just stop at general surgery or even before that? Like, why breast cancer specifically?
So when I chose my specialty, I just fell in love with surgery. And I knew that field just was very something that was going to be a part of me. So my love for general surgery, during my residency, I felt like this was going to be a good place for me to be able to make the most difference in people's lives, while, not just operating on them and then having them, go away, but actually forming a long-term relationship. So I think it's that combination.
That's great. Good answer. Now you two have had time to think about the question. Dr. Patel, I know that you don't just treat breast cancer, but why oncology? Why cancer care? Why radiation oncology?
Yeah, I mean, I've always been interested in oncology. I remember as a young child going to the hospital to visit a family friend. She unfortunately had leukemia, and seeing the physician being able to help our friend, I thought that would be amazing. So I've always liked oncology, but in med school, I also liked radiology. So then I discovered this specialty, which was a perfect combination. And it's technological savvy, and it's very innovative. So it just is it's a blend of two different specialties, and it definitely was my passion and calling.
That's great. Very good. And Mona, tell us what brought you to patient navigation and getting involved at the level that you're involved, specifically with breast cancer.
Well, I started out with HonorHealth, John C. Lincoln, many years ago in the breast center, doing primarily all the scheduling of all the biopsies and procedures. In that, I would also follow up to make sure that they'd get scheduled to see the breast surgeon. At that point, we noticed that there was holes in the system and patients weren't getting scheduled. So there was a program that I had attended to become a certified navigator, and that's where I came on board to become a navigator in general, just with breast, to help these patients move forward and help get timeliness to get their treatment. So that's how it all started with me. Yeah, it stayed with, yeah. And it's actually enrolled for HonorHealth. There's a large navigation team in the oncology clinics throughout the valley. Each oncology clinic at HonorHealth has their own set of patient navigator and nurse navigator now that, once I see the patients, then they get seen with the medical oncologist in that clinic at Deer Valley. At that point, then once they start treatment, then they have a patient navigator and a nurse navigator that follows them through their treatment plan through survivorship.
So then all of those oncologists are part of the Virginia G. Piper Cancer Care Network?
Yes.
Got it.
Yes.
Okay, that makes sense. Okay, that's great. Wonderful. Yeah. Wonderful. Well, I wanted to just ask, it is Breast Cancer Awareness Month, and I want to make sure that we always talk about how important screening and mammography is. So, Dr. Moorthy, as a breast surgeon, how important is screening and mammography? I know that we were kind of putting it on hold during COVID, which wasn't necessarily the best thing for people, but I mean, can help everybody understand the importance behind that.
Sure. So breast cancer it's a curable cancer if it's caught early. And I know a lot of times people are under the impression that if I don't have a family history, I don't need to be as vigilant about my screening. But that's a myth. And so screening should start at 40 annually. If you have a strong family history or if you have other risk factors, then your screening program should be modified to fit that. We actually do have a high-risk clinic. So for patients who have a higher risk of getting breast cancer and need to be followed perhaps earlier or with more imaging than just screening, we do have a high-risk clinic that fits that need as well.
That's great. Good. Get your screening. Got it. Every year after 40. Got it. Got it. Thank you all so much for spending time with me today here in the studio. I really appreciate this conversation, and I know that our audience is really glad to be able to hear what you have to say on such an important topic. So thank you.
Absolutely.
If you'd like more information on Dr. Anushka Patel, radiation oncology, or Dr. Brenda Moorthy, you can go to AZCCC.com. If you'd like some information on the Virginia G. Piper Cancer Care Network Comprehensive Breast Clinic, you can call us at 855-485-HOPE or 4673. Thanks so much, and we'll see you next time.